If you are between the age of 22 to 55, then this is for you. There are some body signals that you must not ignore. So many people are ignorant of these facts and they end up regretting. I don't want that for you. And so please, there are these signals you'll be finding or seeing in your body that when you take care of it immediately or you detect it earlier, you will save yourself a lot of trouble. Are you health and spiritual conscious? Welcome back to my channel. If you are new here, you are welcome. This is Nature Speaks TV and I am Hemali. Today we are looking at some body signals that you must not ignore if you fall between this range of age, 22 to 55 years old. Are you ready? So now let's look at it. When you are between 22 to 35 and you notice any of this in your body, please do not joke with it. Number one, when you notice that you are having this unexplained weight gain or weight loss as someone that is between 22 and 35. And then number two, you find it so difficult to sleep. You are always having this fatigue. You're always getting tired. Every little thing you do, you'll be panting. You are always tired. And you also find it so difficult to sleep. Do not ignore these signs. Number three, when you notice that you are having irregular menstrual cycle, irregular period as a lady, and you know you are not pregnant, please don't joke with this kind of sign. And then number four, when you see that you are having some things, patches in your skin, or just some changes in your skin that you cannot really explain, and then or maybe sometimes you find some moles in your skin, please don't joke with it. The second set of people are those between the age of 36 to 45. If you notice any of these body signals, please do not joke with it. Do not play with it. Okay. Now, when you begin to have elevated blood pressure, cholesterol changes, you have to do something and do it very fast. Number two, when you notice that you are now having frequent urination, unexplained urination, going in and off toilet, sometimes you go to the toilet more than 3-4 times before daybreak, please don't joke with it. When you are now beginning to have some digestive issues like bloating, sometimes you might even see some traces of blood in your stool, do not joke with it. And then when you have this number four, or is it three now? I think it's number four. When you are always having persistent coughing, uncontrollable coughing that is more than 2 weeks, please do not joke with it at all. And then sometimes you begin to have shortness of breath. You are always, looking for air. Remember, we are looking at the age between 36 to 45. When you notice all this that I've mentioned, please do not joke with it. Do not ignore. Remember always that prevention is always better than cure. It is better for you to be on the know, have this vital information, do something, take that necessary action, and before you know, all will end up well for you. Now, if you are seeing my face for the first time, this is Nature Speaks TV, and on this platform we do three things. We talk about health matters, inspiration, and spirituality, presenting all these three in an easy to understand manner for you to understand, internalize, and then you take that action that is needful. Like in this case, we are encouraging you, do not do self-medication. We want you to go to the hospital, do proper diagnose, let them check you, and then they will give you the necessary things that you need to take care of. Don't manage it. Please don't manage. Your health is once. Do not wait until you lose your health. Pay great attention to it. The next group are those between the ages of 46 to 55. And so if you are within this age range and you notice any of these symptoms, please don't joke with it. Number one, when you notice you are now having symptoms of menopause and andropause. Menopause or andropause. Menopause for women and andropause for men. Number two, when you begin to have some stiffness in your joints or back aches as you wake up in the morning, you're always feeling back pains all over you. Please do not joke with it. And then the another one, you are now beginning to have, that's number three, right? You are now beginning to have issues with your brain. When you put something somewhere, you can't remember. Memory loss is setting in, dementia. Please do not joke with this kind of sign. Then the other one is that when you are now having unexplained aches, especially for your lower abdomen, you're always feeling this sharp pain if you come and if you go. Sometimes you might say, let me take water. If you take water, it will actually go. Then after some time, it will still come back again. Please do not joke with it. And so please, if you are seeing me for the first time and you like this kind of content, please, you can like, you can give us a thumbs up, you can subscribe if you have not done so. To my returning subscribers, thank you. God bless you for always coming back to watch our videos. And please, we want you to do this for us. Help us share. Just share. If you find this content useful, inspirational, or it has inspired you one way or the other, shift it to somebody else that may need it. And please, if you are not yet subscribed, I want you to subscribe to this channel. I will see you again. But before then, please, all those symptoms and signals that we have enumerated so far, do not joke with them. We're advising you, take the necessary action. Remember, we tell you to take that